Hi there, I'm Dre, the host and founder of the Dragon Network. On this week's video, I want to talk about the HL7 FHIR Accelerator program and just give you a high-level overview of what that program is, what the different projects that are contained within it are, and where you can go to find more information. But before I jump into the details, if you haven't had a chance to subscribe to the channel yet, please go ahead and do that now. And as always, throughout the video, if you like what you see, don't forget to hit that like button. For those of you that aren't familiar, HL7 International is a not-for-profit, ANSI-accredited standards developing organization that is dedicated to providing a comprehensive framework and related standards for the exchange, integration, sharing, and retrieval of electronic health information to support clinical practice and the management, delivery, and evaluation of health services. I'll put a link down in the description below so you can go to their main page and check out everything that they're all about. We've been hearing a lot about FHIR lately, the Fast Healthcare Interoperability resource, and we're actually starting to see it incorporated into legislation around interoperability and data exchange. So I thought it would be a good time to bring up the FHIR Accelerator program to let you know which different groups are working on standards and to put a little context behind some of the project teams or group names that you've heard in conversations related to interoperability. So according to HL7, the FHIR Accelerator program is designed to assist communities and collaborative groups across the global healthcare spectrum in the creation and adoption of high-quality FHIR implementation guides or other standard artifacts to move toward the realization of global health data interoperability. FHIR Accelerator groups operate within the HL7 organization, but they are separate initiatives. There are currently 7 of them in place. As stakeholder groups and organizations work to define the FHIR standards, the HL7 organization will assist by helping to navigate them through the process and providing them with some basic collaboration infrastructure tools and a range of other services based on what the group's needs are. In alphabetical order, the 7 accelerator projects are the Argonaut Project, which was launched by the private sector in 2014 and is a group of leading technology vendors and provider organizations working alongside other FHIR initiatives such as Smart on FHIR and the FHIR Foundation to create implementation guides for high priority use cases. You can think of the Argonaut Project as focusing on the base standards for general interoperability. Next up, we have the CARIN Alliance, which is an accelerator focused on advancing consumer-directed exchange across the US. Stakeholders in this group are working to develop FHIR implementation guides that are going to give individuals and their caregivers the ability to get, use, and share their digital health information when, where, and how they would like to. Next on the alphabetical list is CodeX, which stands for the Common Oncology Data Elements Extensions. And this accelerator is focused on data exchange standards for cancer care and research, and they're working to develop supplemental M-code FHIR implementation guides to improve data collection and sharing among existing and new applications. The DaVinci Project was formed in 2018, and it is an accelerator working on FHIR standards to support value-based care data exchange between payers and providers. The Gravity Project joined the FHIR Accelerator program in the summer of 2019, and it is an initiative that is focused on the development of standards associated with social determinants of health. Gravity has both a terminology workstream that's focusing on defining the standard data elements and a technical workstream that is focused on addressing how information should be recorded and documented to develop the implementation guides. Helios is the newest accelerator. It was launched towards the end of 2021. This group is made up of government, private sector, and philanthropic stakeholders that are committed to improving interoperability of public health data. It is supported by the US CDC as well as ONC. And last on the alphabetical list is the Vulcan project. Vulcan was launched in September of 2019, not long after the Gravity Project entered the program, and it is comprised of stakeholders across clinical research community dedicated to connecting clinical research with healthcare data. So those are the 7 FHIR Accelerator programs that are in place today. I'm going to put a link in the description below to each of the Confluence sites that are associated with each of these accelerator programs, and those sites will provide you information on absolutely everything that they're up to, including their next steps, their timelines, what they've done so far, and where they're seeing progress. So if you do have any interest in any of those accelerator programs, I encourage you to take a look at that. I am going to, over the course of the next several weeks or months, do a little bit deeper dive into each of these projects so you get a better idea on what they're all about. I hope you have a great rest of your day, and I will see you again soon.